All right, for our second session with Lily, we worked on 4-point positioning over a small exercise ball while dynamically using her upper body, playing with a dollhouse to strengthen her upper extremities and use her back and neck extensors and her core musculature. She was actively keeping neck and back extension during the intervention, and assistance was needed to put her knees into the flexion position because she wanted to use her upper or her lower extremities to extend to help her to get into extension with her upper body. Without flexed knees, I just explained that, and then so we did that to get weight bearing through her arms also.
And then we also had her sit on one of the treatment tables that was low to the ground. And we were trying to have her sit upright while she was playing softball or t-ball with a medium-sized soft little ball on top of the t-ball stand. And we needed to kind of cue her to stay upright throughout that activity. And then also in the sitting position, we had her shoot a basketball through a hula hoop, and we put a stool underneath her feet so that she could stay upright and planted through her feet. She also performed truncal rotation while dynamically using her upper extremities, and this intervention targeted her sitting balance and endurance. And she, again, was regularly cued to keep her back straight and use her core musculature. And she did have one of the SBTs sitting next to her to kind of stabilize her throughout that. And then we also had her sitting on a stool and then completing sit-to-stands to put a puzzle together. And
and then sitting on a chair to standing at a desk to draw in color. And that was mostly to get weight bearing through her lower extremities and get the sit to stand function so she can participate and in school and at home and try to make transfers easier for her and her parents.
Okay, and then based on our 2 sessions with Lily, we wrote 2 goals. So our first goal was that Lily will independently tailor sit on a large wedge to assist with balance for a continuous 30 seconds, showing truncal core strength and stability within 4 months. She currently presents with truncal hypotonia, which causes her difficulty with sitting independently, transferring, ambulating, and keeping healthy posture for her back during all of these activities that are essential for her to participate in social and family activities. And then our second goal is that Lily will perform 10 sit-to-stand transfers with Min Assist in 3 months to allow for increased participation in school and community-based settings. And then our interventions will be pretty similar to what we worked on this last time with her, but we will just increase them and progress them as needed.
All right, so for what we'll do next time, I think our lab session went pretty good for the most part. So there's not a whole lot we would need to change for next time. We did some groundwork ahead of time and thought of some interventions, and we were able to get our patient to partake in them in a way that made her work, but it was also fun for her at the same time. One area we could have improved in, though, was getting our patient to give a high level of effort throughout the more strenuous activities. Like when we were having her do sit-to-stands and ambulate, she didn't really like doing those because it was hard for her. She made it seem like she was working really hard on them, but we didn't realize that she was kind of holding back until Dr. Lundin came over, and then she tried a lot harder. So that's something we have to work on. But we were able to get her to give a lot of effort for tasks that she liked, like when she was playing baseball and basketball. She tried pretty hard and just wanted to keep doing those over and over. So I think that realizing that our patients aren't giving 100% on some of the harder activities earlier and being able to kind of coax them into trying harder is something that comes with experience, and that's something we'll work on in future sessions.